Yeah.
Just
That's
taxable
all-
fringe.
although that's the-
If it's a
that's the
fringe
fringe,
benefit
yeah,
that for you
that's
to
the
get your
fringe.
own whatever.
Good morning, and welcome to Todd County's Board of Commissioners regular board meeting. Today is Tuesday, October 1st. The time is 9 a.m. Roll call, all commissioners are present, along with the auditor, treasurer, and the coordinator. We will now stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd ask for amendments to the agenda.
Yes, Madam Chair, we'd like to add 5.2. It is board action to appoint members to an environmental health appeals board.
Okay. Are there any other amendments to the agenda? If not, I would ask for a motion to approve the agenda.
So moved.
Motion by Nazca. Is there a second?
Second.
Second by Denny. Discussion? Hearing no discussion, all in favor?
Aye.
Opposed? And carries. Then we'll go into the consent items, Denise.
Consent items today are the meeting minute approval for September 17th, 2024, and also hire social worker Amy Brill, start date to be determined.
Okay. Is there a motion for the consent items for the approval?
So moved.
Motion by Denny. Is there a second?
Second.
Second by Newman. Discussion? Hearing no discussion, all in favor?
Aye.
Opposed? And carries. Then administration? Insurance renewal?
You need a quick share right now?
The board action form I have is the 2025 insurance renewal. The background is the Better Health Collective Sourcewell is an insurance pool that the county is part of. Sourcewell, the Better Health Collective, operates as a political subdivision joint self-insurance pool in accordance with Minnesota Statute 471.617 and Minnesota Rule Chapter 278. In turn, per Minnesota state regulation, the pool must market/bid for the TPA every 4 years. This meant that 1/1/25 was the next date the Sourcewell Better Health Collective plan needed to be marketed. The board of directors that governs the insurance pool did their due diligence in RFP efforts this spring, and after evaluating several factors, came to the conclusion that Blue Cross Blue Shield would be the best, lowest cost TPA partner for 1/1/25. Therefore, Blue Cross Blue Shield won the bid, and all other groups in the pool will subsequently move from health partners as the TPA to Blue Cross Blue Shield as the TPA on 1/1/25.
Okay, I would ask for a motion that we remain with Sourcewell, but going to Blue Cross Blue Shield within the Sourcewell bid.
So moved, Madam Chair.
Okay, motion by Newman. Is there a second?
Second.
Second by Byers. Discussion. Hearing no discussion, all in favor?
Aye.
Opposed? And carries.
Want Colleen to present?
I didn't know someone was here to present.
Yeah, because we have to decide what plans we want.
Okay.
There's no option. We have to go, if we're gonna
The
say.
Blue Cross one?
Yes.
Okay.
Colleen, can you hear me? Oh, I got unmute her. Okay, try that again.
Can you hear me?
Can you turn the volume up on there? Yep, you're good to go.
Okay, I'm gonna go ahead and share my screen. Are you able to see my screen, Nellie?
Yep.
Okay, Good morning, everyone. My name is Colleen Schumann, and I'm here with Gallagher Benefits Services, Todd County's benefits consultant for the medical plan. Um, I want to just introduce myself. Nellie, can you just maybe go around the room and just tell me who's in the room so that I understand who we all have on the line today?
Yeah, so on the left, we have Commissioner Denny, District 2, then Commissioner Newman, District 5, Commissioner Becker, District 1, Commissioner Byers, District 3, and Commissioner Nasca, District 4.
Awesome. Okay, so at any point, please feel free to stop me during my presentation, but really the purpose of me coming to the meeting today is to just share the medical renewal information with all of you. I just want to preface this with all of this has been shared with the HR team and leadership here at the county, as well as we met with the insurance committee yesterday to share the same information as well. So I welcome questions. And please stop me if you have any. So, but without further ado, we'll kind of jump right in. So, and Nellie, can you tell me what time I have until, just so that I'm keeping eye on the clock?
I think it's like 9:15 or 9:20, 9:15.
Got it. Okay, sounds great. So, without further ado, we're going to talk a little bit about claims. So, not to get into the weeds, but this is a high level overview of the claims for the county. The county's renewal is determined off of the last 24 months of claims. So, that's what we're showing here. Above the line is the previous rolling 12 months, and below the line is the most recent rolling 12 months. So, I'm going to direct your eyes to the bottom of the screen. If you see here, we paid $3.1 million in premium, and the Better Health Collective, or Sourcewell, our carrier, has paid out $3.2 million in claims. So in the most recent 12-month period, we were running at a loss ratio of 101%. So what that means is for every dollar we're spending in premium, the carrier, or Sourcewell, our pool that we purchase our insurance from, is paying out $1.01 for every dollar we're paying in. If we look above the line, the previous rolling 12 months, so May of 22 through April of 23, we were trending at a loss ratio of 122%. So for every dollar paid in, they were paying out $1.22 in claims. So biggest picture here is, and message here is that our loss ratio is still trending high. It's going in the right direction. We're coming down. But carriers like to see that loss ratio between 80 and 90%. And the reason for that is they like to have 80% so that they're paying claims, but they still have enough to also pay the overhead for administering the network, running member services, the value-added programs, things of that nature. On the next screen, we have high-cost claimants. So in the most recent 12 months, we had 12 high-cost claimants over $50,000. When the renewal is calculated, those claims that are over $100,000 get what we call as pooled out or looked at separately, so that there's a charge that gets added back for those claims, but that you're not necessarily 100% judged on those high claimants, as we know that most groups have a couple of high claimants. But again, we're running hotter than what we would like to see for a group of your size. If we go the previous rolling 12 months high cost claimants, you'll see there were several more over $100,000. Again, so we're trending in the right direction, but still not quite where we need to be in terms of premium to claims being paid out. So then we'll look at the renewal. Before we take a peek at the 2025 renewal, I just wanted to do a renewal recap history for you all. So if you'll see here, we first went to the Better Health Collective, or Sourcewell, to get our insurance in 2018. That was the first year that we went to the Better Health Collective. The Better Health Collective is a pool for public entities in Minnesota. There are several pools, so we'll get to that in a couple of screens. But basically what happened in 2018 is we went to market. The market showed that Sourcewell was able to offer us a very, very favorable proposal of a 25% decrease, which is the reason we moved to Sourcewell. And ever since then, they have been able to offer us rate caps. which has been helpful in terms of budgeting, because we know that once you get a rate cap, we will not receive a renewal higher than that rate cap. And traditionally, we've also been able to perform better than the rate cap. If you see on the right, several of those rate caps in the second to right column are much higher than what our actual renewal came in at. So we did another bidding process in 2021. Sourcewell still was the best offer at a flat renewal, and then so on and so forth. So wanted to just give that high level overview of where we've come and how the Sourcewell or the Better Health Collective has been a favorable partner to the county in the past. One thing I want to note here, so as we move into the medical renewal, where we are getting our, and so it's like a fully insured plan in that we just pay a premium every month and the Sourcewell or Better Health Collective pays the claims on our behalf. But we're pooling risk with other like employers, so other cities, counties, and school districts. The Better Health Collective, so how it works is it's a self-insured plan, and they select a TPA or a third-party administrator to administer the network and purchase stop loss. That TPA currently is Health Partners. For 2025, the Sourcewell Better Health Collective pool did a full market analysis to identify the best TPA partner going forward, as they're supposed to perform this market analysis every 4 years. So this was the year for them to bid that TPA partner. And through that bidding process, they actually did select a different TPA for 2025. So the TPA was selected as Blue Cross Blue Shield. So Sourcewell or the Better Health Collective will continue to pay claims, but the actual stop loss insurance for those high claimants is going to be written on Blue Cross paper now instead of Health Partners, as well as the network and formulary. So the network is going to be a Blue Cross network, the formulary is going to be a Blue Cross formulary. Again, they matched as close as they could to all of the plan designs. There are a few slight nuances, but the Better Health Collective Board of Directors made that collective decision that Blue Cross Blue Shield would be the best partner going forward in terms of cost, customer service, and several other facets that they revealed in their bidding process. So all of that said, the TPA is changing from Health Partners to Blue Cross Blue Shield, but again, Todd County is still getting their insurance through Sourcewell or the Better Health Collective. So while employees' ID cards will change, their network will be Blue Cross, we are still purchasing our insurance from the Better Health Collective. So we had a 12% rate cap in place for 2025. So that's the first line here at the top. We did receive a 12% increase for this year. So we did receive the full rate cap. The Sourcewell or Better Health Collective, they produce a renewal scorecard. So again, they look at your claims for the most recent 12 months. They weight that at 80%. They look at the claims for the recent previous 12 months. They weight that at 20%. And then they have a renewal scorecard. One area of opportunity on that scorecard was wellness. We did not receive any of the points on that specific section, as we didn't meet the enough employee participation or engagement in that program to receive that additional points on the scorecard. So that's one area we can work on for next year for sure, is increasing engagement in that program. They also released a rate cap of 15% for next year. So that also was included with their renewal offer. Below here on the bottom, I am showing the average increase for the collective. So that's all of the members in this self-insured pool. So the overall increase was 9%. And groups received anywhere from a 3% increase to a 15% increase. So again, some groups got lower, some groups got higher than what Todd County received, and the overall collective's average was 9%. They also released rate caps for every group, and those rate caps varied anywhere between 12 and 19% based on where their current rates are at, where their claims are trending, and so on and so forth. So again, towards the higher end of that rate cap pack, so to say, but again, they're still releasing a lower rate cap than what other groups received in the pool. As a general high level, we are seeing rate caps anywhere from that 14 to 19% in the market outside of Sourcewell. So I want to note that although we've seen traditionally rate caps between 9 and 12%, in the market, we are seeing that increase much more, just in terms of how the claims are exponentially increasing, and therefore carriers are struggling to offer rate caps under that kind of 14% threshold without really knowing kind of what is down the pipe for the next couple of years. I'm going to pause there because I've done a lot of talking. Does anybody have any questions so far?
I do, Commissioner Becker, is there any way we can lower that rate cap? Or how can we lower that rate
There-
cap?
Yep, great question. For 2026, you're in referencing?
Yes.
Yes, great question. There is not a way to lower the rate cap. The rate cap is set and determined based on their underwriting, where they believe your claims will fall for the next 12 months and where your claims currently are and the increase that was provided. So if they believe that your increase, right now you receive the rate cap of 12%, they cannot increase your rates any more than that. So part of the reason for the higher end of the rate cap could be because they believe that your trend for this upcoming year may be higher than actually 12%, which is why they have a higher rate cap for the following year. So there is no way to decrease that rate cap. The other thing I want to note about the rate cap is historically, Todd County has marketed the medical plan once every 5 years. Per state statute, Todd County needs to market every 5 years. Now, with that being said, because your collective or where you've purchased the insurance from bid this year, that can cover your state statute requirement, so that next year would be our year to bid for 2026. We wouldn't need to complete that bidding process because Sourcewell did that bidding process for the pool that you're in. With that being said, we still can market the plan for next year. But if we choose to market the plan, that 15% rate cap goes away, and we'd be subject to whatever Sourcewell believes is the appropriate renewal to be released if we go to market. So something to keep in mind.
Okay.
Any other questions? All right, I will keep moving. So again, this is high level. There is going to be that change from Health Partners to Blue Cross Blue Shield. We shared this with the insurance committee. This is a lot more employee facing in terms of what's going to look different, what's going to be the same. For the most part, 95% of all the programs and plan designs and all of that will stay the same and won't be disrupted. But there is about 5% disruption in terms of couple programs going away, couple programs being added. The formulary is slightly different. Whenever we move from a carrier to a carrier, there's always going to be some formulary disruption, as well as potentially some network disruption, and typically that we see that in chiropractic care in terms of disruption on the network. So here is the 12% renewal increase. You'll see the plans. We currently have 3 plans, all on the same open access network. The plans did increase slightly different based on the plan and enrollment. So Smart Plan 1 has our most enrollment and our most claims, which is why it's slightly higher of an increase. The other 2 plans are trending more favorably, which is why they have a slightly lower increase. Overall, it averages to a 12% increase in premiums overall. Again, this dollar difference from current $423,000, that's total premium. So this doesn't take into account the portion that employees pay of the premium. The next thing I just wanted to highlight is the plan designs. So while we are changing to Blue Cross Blue Shield, Blue Cross mirrored the plans as close as they could. There are slight deductible increases on all 3 plans, and this would have occurred whether they stayed with Health Partners or Blue Cross, as all 3 of these plan designs indexed up due to IRS requirements, as all 3 of these plans are HSA plans, and each year the IRS determines the requirements for meeting HSA eligibility. And so that's why these plans had slight deductible increases. So again, that wasn't something that came with Blue Cross, but rather it was an IRS regulation update, which we typically see every year, and in turn caused the deductibles to increase. I also wanted to highlight, we did share this with the committee yesterday. We currently offer 3 plans, so a low, middle, and high plan. They all have 100% coinsurance. The Better Health Collective has a menu of plan options. So this is the menu. There's 8 plan options. You can offer up to 4 plans. We currently have, as I mentioned, a middle, high, and a low plan. They all have 100% coinsurance. So what that means is once a member or an employee meets their deductible, their out-of-pocket has also been satisfied. So the coverage is 100% after deductible. So employees really have to remember one number. Once they meet that deductible number, everything else is covered at 100%. If you see across the board, a couple of these plans offer 80% coinsurance, which means they meet the deductible. So in this case, $1,650. They then have 20% in coinsurance, or they pay 20% of all services up to the out-of-pocket maximum of $3,300. So again, we have those 3 plan designs. We wouldn't recommend any changes to this plan design. We showed this with the committee yesterday, and didn't have any other recommendations for any plan designs from the committee either. And then here at the back, because we're moving again from Health Partners to Blue Cross, there is some slight formulary disruption. So we shared this with the insurance committee, and we will be doing heavy education on this during open enrollment to ensure that it's a smooth transition for all employees. But there are currently 6 prescription drugs that we know of that are being taken on the plan today, and that would no longer be covered on the Blue Cross Blue Shield formulary. With that being said, Blue Cross Blue Shield does have an alternate drug for every single one of these drugs on their formulary. It just might be a different brand name. And then the other thing is, if someone cannot take that alternate drug for clinical reasons, there is an exception process that they can go through to get their drug approved to be paid for, even though it's not on the Blue Cross Blue Shield formulary. So it's a similar process to what Health Partners has. It looks like there's 2 prescription drugs right here that are currently non-formulary. So these 2 prescription drugs, those members probably likely already went through that exception process with Health Partners. They will just need to do that same process with their doctor with the Blue Cross paperwork. So it does say 71 claims. I want to just note that is not 71 members. That's truly 71 prescriptions. So we don't get a number of members, but what they said, it's about a 9% disruption in terms of all of the medications taken on the plan today. So I wanted to mention that we're going to be doing some heavy education. We shared this with the committee, and we are committed to making sure that all employees have the information that they need to make a successful transition with the Better Health Collective moving to Blue Cross. I'm going to pause there. Any questions?
No, I don't believe so.
Okay. And I know I'm running over time here, so I'll leave you with this. This is just a high-level overview of what's happening in the market today. So as I mentioned earlier, there are several pools in Minnesota that a public entity can actually join. In addition to, you can go direct to Blue Cross or direct to Health Partners, direct to Medica, and so on and so forth. But I wanted to just note that the transition from Blue Cross from Health Partners to Blue Cross is not the only change that's happening kind of across all of these pools. So that's the way that the Better Health Collective found better rate stability and transparency, which is how they're maintaining their rate structure and keeping rates manageable and increases manageable for their folks. I wanted to just note that PEEP, the largest pool in Minnesota, is struggling to manage some of those high increases, and in turn they're requiring a 4-year participation in their pool. Sourcewell does not have any participation requirements. You're not locked into a contract by any means, but if you went to PEEP, that would be a 4-year requirement. Minnesota Healthcare Consortium, that's another pool in Minnesota. Their average increase was 7%, but their renewal range was anywhere from 0 to 20, with actually 10 outlier groups that got higher than a 20% increase. So when we look across the board, every pool is trying to do what they can to manage the costs and increase. And I would say, in terms of looking across the board, Dorsville has been a very good partner for Todd County, and they continue to be able to manage renewals within a pretty tight range window in terms of kind of across the board when we look at what other consortiums are doing in Minnesota. So I believe Nellie will be sharing this out to all of you. If you guys have any questions, please let Nellie know, let myself know. Sorry that I went a little bit over time. But if you have any questions, yeah, just certainly let us know and we'd be happy to answer those.
Okay, thank you.
Thank you, Colleen.
Yes, you all have a great session, and Nellie will talk to you later.
All right, so after Colleen presented, you can, if you guys aren't ready to make a decision today, I can bring a board action form back for next board meeting, but we have to have our renewal selection to the Better Health Collective by October 15th. So we have to decide which plans we want to renew with. We can have up to 4 plans. As Colleen stated, as our broker, her recommendation would to be renew the 3 plans we have as is.
Okay, no, we had a motion and a second and a vote already, because I didn't,
That's the switch.
that's just on
But that
switching
would-
to Blue Cross.
Yeah, which
So that
that's
would
not an option.
Okay.
We have to go to Blue Cross Blue Shield if we stay with
Right.
the collective.
So at this point, we would either need to table this until the next meeting, or we would need another motion to go which plans we're going to go into, because you need a motion for the plans, correct?
Correct, yep. With what plans we want to renew with.
Yeah,
I mean, I listened to this entire presentation, but I need more time to go through
Okay.
this. I mean, this is
Okay.
facts.
Which, and I did mark this as a discussion. I had planned to bring it back to the 15th for a vote.
Yeah.
yeah, and because you can't even see the graphs on these small screens and so forth. So at this point, we'll bring it back for a decision on what plans we
October
plan on
15th.
going
Okay.
to
Sounds
the
good.
October meeting. And we're okay with the motion we did make, or should we?
Well, I think we need to remove that motion because this was just a discussion item. I think
Okay.
we jumped the gun by
We
taking the
did.
motion in the second, not realizing it was just
It was for
discussion.
discussion, correct.
If Randy wants to remove and Bob Byers their motion and second,
And leave this going,
and leave this as a discussion for Nellie to bring back a board
And we'll
action.
move this to the, what, 15th?
yes,
Yeah, let's do that.
okay? I don't know who made the motion, who,
I did.
Randy made the
Newman
motion.
And Byers.
Bob said,
I'd rescind mine.
Okay,
So both rescinding, bring back the 15th.
bring back to the 15th, correct. Okay,
got it.
thank you. With
And
that,
then-
we'll,
We'll go on to the 2025 county fee schedule public hearing. Background is Todd County is in the process of building the county fund schedule to be implemented for 2025. It is a requirement by Minnesota statute to hold a public hearing to gather any public input on the proposed fees. Notice of this public hearing has been published in the Todd County newspapers for the weeks of September 16th and 23rd of 2024, and also posted to the county website. A copy of the proposed 2025 county fee schedule document is attached to review. And so, we haven't gotten any
We
comments.
missed our 5-2, right? The appeals board?
Mental
We
health.
added
Oh,
one
we
to the
did.
agenda?
Oh, we did, I missed you.
Yeah.
Well, can I put you after me only for the fact that we've already missed our 9:15 notice of public hearing?
yeah,
But I was going to comment that I have not had any phone calls or any letters on the fee schedule.
the only comment, and it's under the food renewal, and in there, they were going to change for the license, if a person had a license, a food license or whatever, after the first of the year, they were not going to get it refunded as in the past. I would really like to question, because I know so often it's not the people that are buying or doing the license, but it's a banking that makes a difference of when you take over and when you don't take over. And so I don't know if it's fair for the past owner to have to pay for a year and a new owner having to pay for a year, because so I would like to have more discussion on that. That would be a change.
Same amount of work to do a reinspection and to go out to a new establishment as it is for the previous one. So I think what's been challenging is issuing refunds to, it's not something that's easy for our building department to do. So, yeah, that is in the fee schedule.
And that would be a change in our past practice.
Yes, it is. Yes.
And we haven't issued a reimbursement for probably 2 years.
Okay,
It's not something we do frequently, I will say that.
okay. Just a question with that. Okay, I don't know if there was any other comments?
Like I said, I never received any from our office. So and HHS didn't.
Okay,
So we'll just move forward with this in 2025 then as the new fee schedule.
okay, and that you'll bring to the next meeting
But we'll bring it in, it comes in January with everything.
with everything else? Okay. Then should we go back to 5.2?
Yes, moving back to 5.2.
I'll read the board action form. Good morning.
Morning.
Good morning.
Our board action form is to appoint members for the Environmental Health Appeals Board. Some background, Todd County Health and Human Services have received a request for a hearing before the Environmental Health Appeals Board. As stated in Todd County Unified Environmental Health Ordinance, the Todd County Board of Commissioners are responsible to appoint members to the Appeals Board, which shall consist of 5 members, 2 county commissioners, 2 members of the Todd County Public Health Advisory Committee, 1 independent registered sanitarian, or board-certified medical professionals. Your options,
You've got some of the board members listed. correct?
yes, I think it's down in the options. That's okay, thank you.
Okay,
And we have a Commissioner Becker, this is a District 1, so that would make sense to have you on it. Second Commissioner, and then those individuals who serve, Rhonda Blees and Jason Polovic on the Public Health Advisory Committee. They represented the board in the past. And then Doug from Horizon Health. I'm not even gonna try his last name.
I just want to note that Jason and Doug have agreed to participate. I have not been able to reach Rana yet. So I wouldn't mind a recommendation to, if she's unavailable, to just assign another public health advisory member if possible.
okay. So we would need another commissioner?
Correct.
Do it.
I look for another commissioner.
I do.
Commissioner Byers?
Okay.
Volunteered to be on the board? Okay, and then Rhonda, we would go if she can, or another advisory board if she cannot, okay? I would ask for a motion, and can you move that up just a little bit so I can read? Okay. For the advisory, to appoint the following members to the advisory board?
Appeals Board.
To the appeals board. Okay. Then I'd have a motion for that.
So moved.
Motion by Newman. Is there a second?
Second.
Second by Noska. Discussion. Hearing no discussion, all in favor?
Aye. Aye.
Opposed? And carries. Thank you.
Thank you.
Okay, we'll go down to number 7. Yes.
All right, so the first item I have then is to approve the commissioner warrants. Background is sent for review. Recommendation is to approve the commissioner warrants with an ACH and a manual payment totaling in the amount of $102,342.79.
Okay, do I have a motion for the commissioner warrants for $102,342.79?
So moved.
Motion by Denny, is there a second?
Second.
Second by Byers. Discussion? Hearing no discussion, we'll do roll call.
Commissioner Denny?
Yes.
Commissioner Byers?
Yes.
Commissioner Newman,
Yes.
Commissioner Nasca,
Yes.
Commissioner Becker.
Yes.
We got a little hornet here or something.
Get him, Bob.
Oh,
him,
she's
Bob.
got her bead. The next item I have then is the Health and Human Service Commissioner warrants. Background was sent for review. The recommendation is to approve the Health and Human Commissioner warrants with an ACH and a manual payment totaling the amount of $57,713.32.
Okay, I'd ask for a motion for the Health and Human Service warrants for the amount of $75,713.32.
So moved.
Motion by Nazca, is there a second?
Second.
Second by Newman. Discussion? Hearing no discussion, roll call?
Commissioner Nasca?
Yes.
Commissioner Newman?
Yes.
Commissioner Byers?
Yes.
Commissioner Denny?
Yes.
Commissioner Becker.
Yes.
Next item I have then is the Health and Human Service SSIS warrants. Background is sent for review. Recommendation is to approve the Health and Human Service SSIS warrants with an ACH and a manual payment totaling the amount of $111,893.76.
Okay. I'd ask for a motion for the Health and Human Services SSIS warrants for the amount of $111,893.76.
So moved.
Motion, okay, by Commissioner Denny. Is there a second?
Second. I'll take it.
Second by Nazca. Discussion? Hearing no discussion, roll call?
Commissioner Denny?
Yes.
Commissioner Nasca?
Yes.
Commissioner Byers?
Yes.
Commissioner Newman?
Yes.
Commissioner Becker.
Yes.
The next item I have then is the county ditch maintenance assessments for 2025. Background is the Auditor Treasurer's Office, along with the County Ditch Inspector, have proactively been working on improving the cash flow balances within Fund 40 county ditches on an annual basis and presented assessment recommendations at the County Board work session on September 17, 2024. Attached are the maintenance fund assessment recommended for collection during the 2025 tax payable year. Your options are to approve the list of assessments, do not approve the list of assessments, or the third option would propose alternative assessment amounts. The recommendation is that the Todd County Ditch Authority approves the attached resolution for county ditch maintenance assessments for taxes payable 2025. It's a financial implication of $26,611.86, and it is a budgeted item. They are paid through special assessments on the taxpayers' taxes.
Okay. I'd ask for a motion for the county ditch maintenance assessments for tax payable in 2025.
I'll make a motion to approve the list of ditch maintenance assessments for taxes payable 2025.
Okay, motion by Nazca. Is there a second?
Second.
Second by Danny. Discussion? Hearing no discussion, all in favor?
Aye.
Opposed? And carries.
The last item I have then is the tax forfeiture auction online platform. Background is Todd County Auditor Treasurer's Office is responsible for the administration of the tax forfeiture procedures for property located within the county. Due to the recent major legislative changes requiring new tax forfeit sale procedures to be performed, the Auditor Treasurer's Office is recommending moving the tax forfeited auction process from an in-person event to an online auction platform. After much research, the Auditor Treasurer's Office recommends approval of the attached agreement with Bid for Assets. There is no upfront cost to Todd County for this online auction service. This agreement has been reviewed by the county attorney. Your options are to authorize the Auditor Treasurer to sign the agreement with Bid for Assets or do not approve. And the recommendation is to authorize Todd County Auditor Treasurer to sign the agreement with Bid for Assets for an online auction platform for Todd County's tax forfeited property auctions. The vendor did a Zoom meeting. Unfortunately, I was out for family leave, and so Jolene and Becky attended it, and they have a list of pros and cons. The majority of this comes from that Taylor Hennepin lawsuit, and you're probably all inundated with the information you received at AMC and all your other meetings you attend. But the new process now is you do a sale on market value, then you do a second sale on cost, and then you do a third sale that goes by our old rules where you would be involved in the market value of it again. And so we could potentially, within less than a year's time, have to do 9 sales. To get all this research done and do everything properly by the new laws would not kiddingly take at least 2 to 3 more staff people. And so by going through this online bid service, a lot of counties are doing this because of the new laws we have to follow. The timeframes are shortened. I mean, by the time you do the research, you've got to be having something online. We did have John review it. He was comfortable with the agreement. I know several counties are implementing this company, and so I think it's just a great option for us. There's no upfront cost to the county. Any fees that would be paid, they're paid by the purchaser. County would still receive a percentage. We'd receive our fees that we get. This online service just receives a percentage of the sale. So, in my opinion, just reviewing what they observed through this Zoom meeting and this sales pitch, it's a win-win for our office to make sure this is all done legally too, because we don't want to be caught in a catch-20 on doing something incorrect with all the new laws changing.
Yeah, so Denise, do you know what percentage of the sale they actually take? Because I was gonna ask the cost of it, but you did say
No cost to the
percentage of.
county for the service, convenient fees to be paid by the purchaser. I would have to get that, I don't think it says that on here. I wanna say it was a 5%, but don't quote me on that, I can message the gals and they can.
But that 5% is paid by the purchaser.
But all that money is paid through that sale.
Yeah,
Yes.
Okay,
So it doesn't
so
take
either
anything off
way,
the
it
top of
doesn't
Not
take
us.
anything off
No,
of,
Right,
thank
off
you
of
for
the
yeah,
clarifying
county.
that. They'll just get a portion of the sale like a realtor would,
Okay.
but it's not any of the county funds.
Okay,
It would just be their cost for handling the online,
okay.
so, yeah.
With that, I'd ask for a motion for the, online auction format for the tax forfeited property auctions, and what was it called, bid for assets?
Yes, bid for assets, yep.
Okay. Someone like to make a motion?
Yeah, I'll make the motion to go ahead with that.
Okay, Denny made a motion, is there a second?
I'll second it.
Second by Noska, discussion.
Yes, Madam Chair. DNR still gets first choice.
I thought you'd ask that, and I do have that in my notes. DNR's timeframe to review and pull, it has been shortened. They get a 30-day window, and that's it.
That's it. But anything with water, pertaining to water, they still get their paws on
30
it?
days, and that's it.
Okay.
And also, there is also the public use, like when cities would pull them.
Yep.
It has to go through the first sale, the second sale, and only at the third sale is the city's given the opportunity to pull that for their use. So that's good in county eyes because we're
Right.
keeping it in revenue dollars then.
But all based on a lawsuit that happened down in Minneapolis.
Yep, Hennepin County.
Denise, is there a signed contract, a length of time for this then?
No, I do not believe, I think it's just, John, do you know when you reviewed it? I'm sorry, like I said, I was out for a leave, so. Is there a certain time that we are in contract with these, or it's just probably till we give notice?
It will be renewed automatically, annually, unless either side says we don't want to.
Okay, so it's a one-year contract.
That's right.
Renewable.
That's right.
Okay,
And Madam Chair, if any of the board members want a little bit, a 30-second background on the Tyler versus Hennepin County case, I'd be glad to.
yeah, that's by all means.
The U.S. Supreme Court, not the Minnesota Supreme Court, but the U.S. Supreme Court, and I believe it was a unanimous decision, said we have to stop in cases of tax forfeiture, satisfying the tax debt, and then keeping whatever's left over. That's what we had done forever in Minnesota. The U.S. Supreme Court said, you can't do that anymore. That's an illegal taking. It's unconstitutional. And even though the folks who are the record owners of this property didn't pay their taxes, they're entitled to whatever's left over. I know for the work that I do, we are probating properties that have huge medical assistance liens. And so we're also looking at those cases and conscious of the tight timeframes. So properties that have an MA lien aren't lost and through the auction process, so we can still recover some of that money by probating and selling those properties ourselves. So, thank you.
Okay, thank you. So the probating is still being done on these properties? Okay. I have any more discussion? I have a motion and a second. So all in favor?
Aye.
Opposed? And carries.
Thank you, Madam Chair.
Okay. Hands of Hope? Good morning.
Good morning. October is Domestic Violence Awareness Month, and we at Hands of Hope would like the Todd County Board of Commissioners to proclaim the month National Domestic Violence Awareness Month following the proclamation. Whereas October is annually recognized as National Domestic Violence Awareness Month, and whereas although progress has been made toward preventing and ending domestic violence and providing support to survivors and their families, important work remains to be done. And whereas policymakers and communities must work together to transform the conditions that cause domestic violence and support survivor-centered solutions. And whereas there is a need to provide education, awareness, and understanding of domestic violence and its causes. And whereas there is a need to focus on the individualized needs of domestic violence survivors. And whereas domestic violence affects people of all genders, sexual orientations, ages, racial, ethnic, cultural, social, religious, and economic groups in the United States. And now therefore be it resolved, all communities deserve access to culturally responsive prevention programs and initiatives to improve overall community health and safety by challenging the societal norms that perpetuate violence. And be it further resolved that the Todd County Board of Commissioners does hereby proclaim October 2024 as Domestic Violence Awareness Month, and to support, promote, and educate awareness above the far-reaching impact of domestic violence.
Okay. I would ask for a motion for a resolution to proclaim October 2024 as Domestic Violence Awareness Month.
I'll make that motion.
Motion by Denny. Is there a second?
Second.
Second by Byers. Discussion. First of all, thank you for all that you guys do.
Thank you.
Thank you.
Thanks for running your Facebook page and your online presence too, about bringing awareness to it, and do appreciate seeing all that. And as heartbreaking as it is good to constantly keep educating people every day with it. So thank you for doing that.
Thank you.
Any further discussion? If not, all in favor?
Aye.
Opposed? And carries. Thank you.
Thank you so much.
We would like to have a photo taken again.
Sure.
This is kind of going to be a regular thing, so. And can we do it in front so that we have a closer
Absolutely.
one? Thank you.
Let's go down there.
Okay, next on the agenda would be the solid waste.
And Madam Chair, our solid waste representatives, Mike Everly and Chris McCon, were unable to be here today, so I'm stepping in. Minnesota statute 297H requires that political subdivisions declare by resolution the market price for services related to solid waste management each year. If the tip fee is less than the market price and the political subdivision subsidizes the cost of service at the facility, then the subdivision is responsible for the tax. Todd County does not have a tip fee below the market price and therefore does not have this tax responsibility. And there is in the packet today a table illustrating the calculation showing that. The options are to authorize the chair to sign the resolution establishing the market price at $82, or do not authorize the chair to sign the resolution. And the recommendation is that the Todd County Board of Commissioners approves the following by motion. Authorize the chair to sign the resolution establishing the market price at $82, which Mike Eberly is reporting is the same as last year's.
Okay. I would ask for a motion to authorize the chair to sign a resolution establishing the market price at $82 for the solid waste.
So moved.
Motion by Byers. Is there a second?
Second.
Second by Danny. Discussion? Hearing no discussion, all in favor?
Aye.
Opposed, and carries. Thank you. Planning and zoning.
I don't believe so. I think it works just like your desk phone.
First of all, Adam, you can get who on the phone?
Mark Hill, the developer.
The
So if
developer.
there's any questions
If
for
it-
Mark, he'll be available to
If
answer.
anyone has any questions.
Hello?
Hey, Mark, it's Adam here and the county board.
Hey,
We're just gonna start your item here, so if you can just hang tight, there may be some questions for you.
okay, sounds good.
Okay, the first item here is the North Star RNG LLC request for CUP. An application for a conditional use permit on parcels 18,003 to 600, 18,003,3000, 18,0040800, 18,0040700, and 18,0032300, all in Long Prairie Township, for the construction and operation of an anaerobic digester to renewable natural gas project was submitted on March 11th of 2024. This application was reviewed by the Planning Commission during the August 15th, September 5th, and October 1st public hearings, and the final recommendation from the Planning Commission was to grant the CUP with the conditions listed below. The public petition for EAW was denied, and notice was received of this on September 23rd, so the county would have 60 days from the 23rd to reach a decision on this application. Options are to adopt the findings of the Planning Commission and grant the CUP, establish the findings to deny the CUP, or remand it back to the Planning Commission for further review. Recommendation is to adopt the findings of the Planning Commission and grant the CUP with the following conditions. 1, the applicant shall obtain all necessary permitting from other governmental agencies prior to issuance of land use permits, including but not limited to the Minnesota Pollution Control Agency. 2, applicant must abide by construction stormwater requirements identified in Minnesota Rule 7090. 3, proposed facility shall be constructed and installed in accordance with engineered plans. 4, applicant shall host an on-site meeting with all local public safety personnel to review the emergency response plan prior to the start of operation. 5, the applicant shall host an annual on-site safety meeting with all local public safety personnel to review the emergency response plan and changes to the operation, and Todd County shall be invited as an attendee to verify completion. 6, proposed digester is restricted to the digestion of manure. Conversion to other feedstock shall require the review of the Planning Commission. 7, the applicant shall abide by all their applicable federal, state, and local standards. 8, failure to meet any of the identified conditions above may result in revocation of this permit following the procedures established by and listed in the Todd County Planning and Zoning Ordinance. And 9, upon abandonment of 1 year, termination or non-renewal of any permit or certificate necessary to operate the facility, or failure to operate the facility in a manner consistent with this ordinance or with the state and federal regulations, the landowner and the owner and operator shall remain responsible for all costs of closure, cleanup, or other costs necessary to bring the property into compliance with all federal, state, and county regulations and to restore the property to a suitable use.
Okay, commissioners, any questions?
Yes, Madam Chair, I got a question. On our board action form, it just says grant the cup. Who we granting the cup to? Is it North Star or is it Dairy Ridge? And my question would be, how can we grant the CUP to somebody other than the landowner?
Yep, so the developer or the applicant can be different than the landowner, but if you look, it might be the second or third page, in the conditional use proceeding, it identifies both of those parties, that the CUP is issued to the property, but it's in the matter of North Star RNG as the applicant on Dairy Ridge's property.
So our board action should have said that grant the cup to North Star with the conditions listed below.
Yep.
Okay, it doesn't say that, it just says cup, so.
Well, it says,
And then you go down further and it says the same thing, grant the cup with the following conditions. So the planning commission granted the cup to who?
We can amend the board action to include those components.
That would be nice.
Yep, certainly can do that. Another thing, a question you had asked a while back was about if this was an amendment to the existing CUP at Dairy Ridge, or if this is new. That's another thing that we can add into this request on what actually gets recorded to the property, that this will be an amendment to that conditional use permit. If in the bottom portion, that CUP number 2024-004, that's the number that's just spit out by our permitting system.
Because Dairy Ridge already has a cup, right?
That's correct.
Okay, so this should be added to that.
That's correct, and that's what it will be, and we can identify that specifically in this document that Barb, as the chair, would sign. So we can make those minor amendments and get it to the auditor treasurer's office for review.
My other issues that I'm having lately is who's gonna enforce these conditions? Todd County, state of Minnesota, who? And that's, my biggest thing is protecting the residents of Todd County. And if our ordinances aren't gonna be enforced, or we're not gonna be working with the state and federal on a level, this should actually be reviewed about every 6 months. And that probably should be a condition that we should put on it as a board, because some of our conditions that we've been applying to CUPs, again, have not been enforced. And why are we passing them if they're not being enforced?
We can add that as a condition. My hesitancy with a condition such as that is we're really creating conditions that condition the county and don't condition the application or the landowner. So we can take the steps and make it practice for us that we review this on a regular basis. But we're putting ourselves in a position that if any point in time we skip that, the condition was placed on the county, not on the application or the developer. That doesn't mean you can't place it in there. That's just my opinion on a condition such as that. We certainly can do regular review in this. To answer your first part of that, the county would be responsible for any ordinance violations or reviewing these conditions, and then we would work with John's office if any enforcement is necessary to go through that process. And then the permits that the MPCA or other state agencies issue, they're responsible for that.
My question, I have at least one question is, are there, I think I'm understanding, and I've had some conversations with Mr. Hill, that the likely choice for the pipeline will be Center Point? I mean, they haven't responded, but if you were a betting man, you would think that Center Point's gonna be the pipeline this goes into, are there any right-of-way issues that we have to deal with that I'm not?
Yeah, so in all likelihood, it's gonna go into Centerpoint. I can't say for certain because they've done a feasibility study, it's feasible to go into, but I don't have a contract signed with them. It's just a large organization, and they take their time on things, and I can't sign a contract until I have certainty on all the permitting that goes along with it. But since they're a utility, they are, I'm not an expert on utilities in Minnesota, but typically when we work with utilities, they have different right-of-way access than a private individual would. And so they would own and operate and get whatever necessary right-of-ways from their City Gate station on the east side of Long Prairie to this facility. And then, so they run it and they place their interconnect right on the dairy property itself.
I guess, Adam, you kind of addressed the two questions I had, was the CUP, and it doesn't affect the other CUP that Dairy Ridge has got out there, correct?
Correct. This, I think if I understand your question correctly, this doesn't authorize any expansion to the dairy. This
Okay.
is authorizing the specific activity of the anaerobic digester that was in that application. It does not authorize anything beyond that.
Okay. And the other one, we follow up from Bob also, is that signed contract with the gas plant. What if they do not sign? Then what happens? What's step two? And do we have anything coming back? Because once we do this today, if we approve it or whatever, what's our next step if they do not sign with that gas company?
I guess I don't specifically know the answer to that or what the alternatives are. If they don't sign with Centerpoint, they may go with the other company, I don't remember the name, or the third option would be to truck it from the site, which I know that's not a desirable option for them. Sorry, Mark, if you have more to add.
Yeah, we will not truck. So that was asked in the Planning and Zoning Board, and if for some reason we got to that point, I don't see us getting there, we'd have to go back and amend this or ask permission to do that. Trucking is very expensive to do. So our secondary option would be running along the dairy-owned property. There's multiple parcels involved, and that was part of the packet we sent in, over to the Northern Natural Gas Interstate Pipeline. But I would anticipate that being less than a 5% chance right now.
Okay, and we got that covered in
Yeah.
CUP?
We can add that as a condition, that I don't know how we'd word that exactly, but that the gas be directly injected into some sort of public utility, and just specify that trucking from the site shall not be allowed unless it was further reviewed by the planning commission at that time. That is a condition we can add.
I think we have to add some kind of a coverage in there.
That's fine, yeah.
Yep. And we're fine with that. I just, if it could be into an existing natural gas pipeline, technically Northern Natural Gas is an interstate pipeline, not a public utility.
Then we gotta understand that a little bit. I mean, I think there's a lot of positives that this can have, but also less than 5% chance, well, probably less than 5% chance that I live to be 85 or 92. My point is, that's not a public utility pipeline then, which is a different conversation on right-of-way stuff. And I'd need to see the map of what you're talking about, those pipelines going through those, I think you mentioned probably Dairy Ridge parcels.
Yeah.
Because if there are stuff that has to go underneath highways or stuff like that, that's a different discussion. It really is, because, and in a matter of fact, because down in Morris, they had to, that one that we went to, they had to go through a lot of private lands, and honestly, they collect a amazing royalty from that. So I don't have it clear in my head here right now that, you know.
So for clarity, that was part of our packet. We submitted both plans And there is no public right of way. There is one road crossing required, but it wouldn't be a public, basically running around county ditches or anything like that.
Madam Chair, if I may.
Yes.
So I'm not sure, Mark, if it's okay, but if we were to condition this to say that it goes to Centerpoint, and if it doesn't, then it comes back to the planning commission, is that something we can do? I mean, that solves that, you know, it keeps it to right to where it was supposed to be, and then it doesn't allow that outside influence?
That's fine.
Okay.
I don't anticipate it being an issue.
Well, I'm just to make it, to clarify it and to make it easy. I mean, if it doesn't work out for you and you have to come back here and ask us to put it somewhere else, then we'll go through that process when we'll cross that bridge when we get there.
Yeah.
I think that type of condition is acceptable if the applicant had agreed to it.
That's why I was asking if
So
he was.
I can add that one also. It would say something into effect that they provide that interconnection agreement, verifying connection with Centerpoint
That's
before.
one of the main points is where that and how
Where's
it's
it gonna go?
connected.
Yeah.
Any other questions or comments, commissioners?
So sorry, I had one question on this, if that's okay to ask right now.
Yes.
Okay. So in the comments, you mentioned of reviewing the CUP every 6 months. We have no problem enforcing this continuously through state agencies, through county agencies. But as somebody who's putting millions of dollars in the ground, if the CUP could be changed every 6 months, that presents a risk for us. You can probably understand it coming from our perspective, that we want some certainty around the rules that we're abiding by during this process.
May I answer to that?
Yes, go
Yeah,
ahead.
okay. So to answer your question, Mark, in the review process of once a county board approves a conditional use permit with those conditions are not up for debate or to be changed without the approval of the landowner or the applicant. The county board in that review process is only reviewing the language of the CUP that exists there. So there's not any opportunity to change the conditions once it's approved.
Okay. All right. I appreciate that clarification. Thank you.
And I think the inspection's more for the safety aspect of.
Yep.
Yeah.
I'd like, Mark, this is Commissioner Byers again. Could you, I know we've had, like I said, some email discussions, and thanks for sending us the virtual tour of the facility. I think that helped a few of us out. Can you speak a little bit about what happens with the I mean, what can we expect with nitrate levels now that it goes through a digester and gets reapplied? Is that, I know you mentioned that the plants soak it up more quickly or more readily?
Yeah, and so our process, during our process, we don't add anything to the manure. We don't take anything out of the manure other than we're digesting some of the leftover energy and turning it into methane. So the nitrogen, phosphorus, potassium, the three main nutrients stay the same. The nitrogen is converted into a form that is more easily absorbed by plants. So it's an ammonium, not ammonia, but ammonium. And I sent you a link to that Penn State study that basically says that it acts more like a readily absorbable commercial fertilizer, which allows more exact application of manure and allows less runoff in the process. So there is some benefits in terms of plants absorbing it, but it's the same amount of nitrogen.
Thank you.
Okay, any other questions or comments? Okay, and
I got one.
Okay.
Commissioner Byers, you were over in Stevens County, correct?
True.
Was there any smell coming out of that digester that you could smell?
Completely, yeah, it was a completely different digester. I mean, I didn't have a really, I didn't smell anything really, to be honest with you. I mean, that feedlot was, you could scrape the cement. It was immaculate. I've seen, my house isn't that clean, to be honest with you. I mean, it was crazy. It was, it's a high scale operation. It really was. But I didn't really smell anything.
Okay.
Sorry.
And as we go on, we have 3 options available for us today. It's adapt the findings of the Planning Commission to grant the CUP, establish findings to deny the CUP, or remain back to the Planning Commission for further review. And the CUP is going to be granted if is it Dairy Ridge or North Star?
It's granted to North Star as the applicant, recorded to Dairy Ridge's property. So there's that responsibility to, it's essentially both. And if the decision is made to grant this, there are these extra conditions that are not identified on the sheet there. So I would update these things, but if you want me to just walk through what those are
I think you
proposed
better
also.
walk through them one more time, Adam.
Okay, so in addition to the 9 you see up there, we're looking at adding the condition that they provide that connection or some sort of verification that they've made the connection to CenterPoint Energy, and we would get that prior to us issuing any of the land use permits. And even before we record the CUP at all, we would get that verification from them. Another condition that trucking would not be allowed, that it's got to be injected into the pipeline. And then the last one was if we want to add that condition of a review of the conditions every 6 months, or maybe it's every 6 months for the first 2 years or something like that. I don't know, but if we want to include that also, I'll leave that up to the board.
We gotta be clear, it can't be every 6 months, it's gotta be what it is. I don't wanna be, we're gonna do 6 months, and then it's 6 months, is that it, I'm just saying for.
Every CUP, then, do we have to go check it every 6 months? Every.
No,
Well, it'd be specific to this.
The way Adam said it to me, I was like, or whatever, no, there's no whatever here, it's either, it's black and white.
Yeah, you gotta have
That's all I'm
something
saying,
definite.
I don't care either way, I just, for the record, it can't be gray.
This is the first of its kind in Todd County, so, I mean, that's something that we need to.
I don't think it's a big deal, Lou. I just think it's gotta be 6 months. Is it the first year, or is it 6 months every year? I don't.
Yeah.
Whatever, I think whoever.
Randy suggested.
Yeah. Randy, I think we're all looking at you where.
Is it a 5-year term? I don't really care, I just.
Well, it goes back, it goes back to enforcement, okay? If you guys start pulling up some CUPs and start looking at how much the county's been enforcing our conditions on our CUPs, you're gonna be shocked. So the thing is that's what I'm saying with this. This is the first of its kind, okay? You're dealing with gas, okay? So 6 months, every 6 months, review it, okay? And put the documentation in the file. Pretty simple.
So you're saying every 6 months ongoing?
Yeah.
That's what he's asking for, so.
Okay.
We have no idea what we're voting on until it gets put up, and then we start watching it, so.
So then in addition to the 9 that were proposed by the Planning Commission, be those 3 additional conditions for a total of 12.
I think that's it.
Okay. Then I'd ask Commissioners, how would you like to handle it? This point, I'd ask for a motion and state what your motion would be.
I guess I'll make the motion to adopt the findings of the planning commission to grant the CUP with the 9 conditions and the additional 3 to make it total 12 conditions. And I want to grant this to North Star on Dairy Ridge property.
Okay, we've got the motion down by Denny. Is there a second?
I'll second that motion.
Second by Nazca. Discussion. Any further discussion? If not, all in favor?
Aye.
Opposed?
Aye. I'm concerned about the conditions.
Okay, and it carries then.
All right, thanks, Mark.
All right, thank you.
Thank you. Okay, next we'll go on to the Region 5 proposed.
Yep. So Region 5 has submitted a proposal to Todd County to provide the consulting service to the rewrite of the Todd County Comprehensive Plan. This proposal was reviewed during the September 3rd and 17th Commissioners' Work Session. The proposal needs to be approved by the Board of Commissioners to enter an agreement with Region 5. Options are to approve this proposal from Region 5 or do not approve. The recommendation is to approve the proposal from Region 5 to provide consulting services for rewriting the Todd County Comprehensive Plan. Well, one other thing I'd like to note is after that meeting on the 17th, I got back to my office and I had a response from Sourcewell that we had the third-party services reimbursement application to pay for these services approved. We will have to split this between 2 fiscal years, so we'll come January of next year, we'll have to reapply in order to finish out the process, but we did get this first round, or at least for this fiscal year, approved. And the other question that Savannah was looking to have answered was whether the board wanted to start in February, or if we could wait and start in April. She was fine either way. It's just if we start in February, then the meetings would have to be during the daytime. If we wait to April, we can do all evening meetings, which is easier for the general public who maybe have day jobs to attend those meetings.
Okay, I guess we got to answer a couple questions. Meeting or start time would be February or April. Opinions? The day meeting, night meetings, April, you're thinking?
Okay.
I think we're gonna have a lot on our plate till February, aren't we?
Yeah,
That's just
very easily.
Yes,
Okay,
hopefully by April we're done with that.
okay. Then I would ask for a motion to have Region 5 complete a comprehensive plan for the county and starting in April.
So moved.
Motion by Byers. Is there a second?
Second.
Second by Noska. Discussion. Hearing no discussion, all in favor?
Aye.
Opposed? And carries. And you'll get in contact with Region 5 then?
Yep. You'll, well, she'll have to sign that agreement and then they'll sign it, give us a copy back after that. And I think we'll just have to wait till April then.
Okay,
Okay, awesome. Thank you.
thank you. Okay. At this time, the board will go into a closed session for negotiation strategies. The commissioners will hold a closed session pursuant to Minnesota Statute 13D.03 to consider strategies for labor negotiations. And we'll take a few-minute break before we go into the room.
You're ready to go.
Okay. As we're coming back from labor negotiations, we had a very useful meeting discussing negotiations, but I would ask for a motion to reopen the meeting.
I'll make the motion to reopen the meeting.
Motion by Denny, is there a second?
Second.
Second by Nazca. Discussion? Hearing no discussion, the meeting is now open and the time is 11:53. With that, we will go into the standing reports. Auditor Treasurer?
Since our last meeting, which I was not in attendance, I had attended the AMC conference. Absentee voting has remained steady. We're getting anywhere from 40 to 50 absentee ballots a day in the mail. Our counter is very busy. Our counter is also very busy with taxes. Taxes are due October 15th, which is the next board meeting. We do have reminders in the paper. I just want people to know that the drop box was moved from in front of the courthouse because of the construction of the rock wall. It has now been relocated at the bottom of the hill, and that's located on 2nd Avenue South. So the drop box will still be there for the convenience of taxpayers. It's just in a different location temporarily. And again, that's just due from construction. And I'd like to thank the department heads and commissioners for the beautiful wind chime for the loss of my brother. It meant a lot, so thank you.
With that, County Attorney's report.
Madam Chair, nothing new to report, thank you.
Okay. County Coordinator.
Just real quickly, on October 9th at 7 o'clock, there will be a candidate forum event with our very own county commissioners that will be participating. Commissioner Byers, Commissioner Becker, and Commissioner Newman, as well as there's Commissioner Becker's opponent, Sharon Thiel, will be there. So just inviting the public, that will be at the Long Prairie Secondary High School, 7 o'clock, October 9th.
Okay, with that, we'll go into Commissioners' reports. Commissioner Byers?
Thank you, Madam Chair. Let's see here. I'll write that down. Okay, so we had broadband. Barbara and I attended the broadband last week up in Browerville with SciTech was the presenter. We also had facilities meeting last Friday. Safety meeting after that, which I attended via Zoom. And then we attended a child care summit in the city of Long Prairie. And I think that's all I got for now.
Okay, Commissioner Nazca?
Thank you. For me, I missed a couple meetings last week and a half. I was on vacation. Nothing really exceptional, the ones I did make, so nothing new to report.
Okay, Commissioner Denny?
Yep, I had my Hands of Hope meeting, our Great River Regional Library meeting, Prairie Lakes meeting. We were going forward with our ash utilization grants and stuff, applying for funding for that. So going forward with that. Other than that, there's nothing new.
Okay. Commissioner Newman?
Yes, Madam Chair, on the 17th, attended the Sauk River Watershed meeting down in Cold Spring. I thank Commissioner Kalina from Douglas for driving. On the 23rd, had CPT meeting in Morris. Faribault County decided to join CPT. They're not going to be an active member, but they're going to be participating. So we're up to, I think, 26 or 27 counties. And then yesterday had an insurance meeting, so that's all I got.
Okay. And for myself, we had a personnel meeting. I attended the broadband meeting in Browerville, the daycare summit here in Long Prairie. Also had the Region 5 meeting, facility meeting, and the insurance meeting. And I'd like to make a comment today. At 3 o'clock, we had the cannabis meeting with the townships and cities. So just make everyone aware of that. And also in the Todd Wadena electrical paper that we get for Todd Wadena Electric, they had a write-up on Melissa and the Todd County Development. So I like to shout out to Melissa for all the work that she does also. With that, if there's no other business to come before the board, I'd ask for a motion to recess until October 15th.
So moved.
Motion by Noska, is there a second?
Second,
Who wants
They're
it?
both close.
Newman gets it.
Second by Newman. All in favor?
Aye.
Opposed? We're recessed. And then we'll start the work session. You guys ready to go right away?
Yeah,
Okay, we'll go ahead.
please.
All right, ready for us to start?
Yes, we are.
All right, Kim and I are here today because we recently received a retirement for Ron Hibbs. Ron is our mental health worker, which is a social worker. He is expected or put in his retirement date for December 30th.
Yep.
So with that, we will need to fill the position, but we're looking at filling it or requesting to fill it in it differently. I think when we went through Springstead some years ago, he was classified with his degree as a mental health worker. We would like to change that position back to a social worker position. So we're able to, I think we're gonna have a better applicant pool to fit the market and really what today's needs are. To be a social worker versus a mental health worker, which is a master's level degree, so.
So it'd be going from a grade 11 to a grade 10.
Right, so with that, we went to personnel who suggested we come to work session, which we always do, and then we're hoping we can bring it to board. It would be a cost savings to the county, but also it would right fit the position and the need for today.
Okay. Questions?
Nope. Thank you.
And with that, we would request that hire the social worker as well. So
Right.
Yeah.
And so that social worker putting in this would be considered a new position?
Yes, a new position, but we'll eliminate Ron's mental health worker position as of 12/30 or 12/31, whatever HR thinks. 'Cause
Okay.
His last day, I believe, in the office will be 12/30.
Okay.
And this would give him time to train in the new social worker on his position because he does have some of our specialty populations are mentally ill and dangerous and our sex offender population at St. Peter's. So we'd like time for that training as well.
Okay. And with,
Would like us to come with two BAFs, one to eliminate the mental health worker position as of 12/30 or 12/31, whatever Nellie recommends to us.
Yeah.
But then a request to hire a social worker as
as a
replacement.
correct.
So we're
Just-
still at a even number, not plus or minus
Yeah.
one, it'd still be the same.
Okay. Any questions?
No.
Understanding? Okay,
I just
yes.
have a quick question. I think I got confused in there. So the BAF will be to eliminate Ron's position, but then the second BAF will be to hire, is that person coming on earlier so Ron can train him?
Yes.
Okay, that's what I thought.
Yeah,
I just thought I missed something there. Thank you.
No, thank you.
okay.
Okay, thank
And
you.
that will be on the October 15th.
Yes.
Yes.
Okay, very good. Thank you.
Great, thank you.
Jackie, do you want me to stick around for the daycare?
Yeah,
Oh, okay.
yeah.
Thanks, Kim.
So our next topic is the affordable childcare discussion, and I really am going to turn it over to Commissioner Byers and Commissioner Becker right away, but I'm introducing it only because I was approached by the Chamber of Commerce Director here in Long Prairie, Lou Thomas Brunkhorst, and our Economic Development Director, Melissa Wyman, with a concern about a daycare facility here in Long Prairie closing the middle of this month at Trinity Lutheran Church, which will cause 38 daycare spots to close, as well as 3 home daycares closing within the next few months. So they came forward to me asking about concerns, and it kind of coincided with the roundtable luncheon last Thursday that the chamber held, and I believe Commissioner Byers and Commissioner Becker attended that. I was not able to attend, but they filled me in on what was going to be discussed. And it's centered around also grant funds and a possibility of a building. So I think with that, maybe I'll turn it over to the two of you to kind of talk about what you heard at the roundtable luncheon last week.
Go ahead.
Thank you, Jackie. Well, what we heard was that there's a severe shortage of daycare in Todd County. Now, this meeting was specifically about the Long Prairie area, which covers the cities of Gray Eagle, Bertram, and Long Prairie, and their numbers. So, yeah, given the, like you said, the closure of the Trinity Lutheran facility and a couple of private daycares, they are currently looking at this pod concept, which is up and running in Morris. And they are going to, it'll be 6 pod units, so 6 daycares. There'll be 72 spots available. And they're looking for community partnerships. Right now, the city of Long Prairie is going to donate the land and the utility hookups in the industrial park, is what their commitment is right now, which is approximately $150,000. They did apply for the deed childcare grant of $600,000, but that requires a match of another $600,000. So they're trying to figure out how to cover the additional $600,000 needed. So that's what they're looking for, community partners and whatnot on that prospect. I'm trying to think, there was a couple of stats that I thought were important. Yeah, in the Long Prairie area, again, this is Bertram, Gray Eagle, Long Prairie. There's basically hundreds of spots that need to be filled. And we all know that the cost of daycare, some of us know more than others. I mean, I'm not sure what everybody that has children of this age are paying nowadays, but it's got to be thousands of dollars a month, I'm assuming.
It's not cheap.
What's that?
It's not cheap. No.
Not cheap, right. So, you know, they obviously they're looking at the county. I think Stevens County, actually, their county does actually have their kind of funding of some sorts, aren't they?
So yes, I had a meeting with the Stevens County Administrator, Becky Young, and they did build a facility there, and they do have 6 pods that are operating. They are, the backup plan is these are single unit homes as well. So if the pods weren't going to be successful, they had to have it so that they could then turn those into homes. Every pod has its own address. So each daycare runs as its own independent daycare and its own small business. But they have been successful, and they have a waiting list of 5 people waiting if any one of those daycares closes. So the plan is now they're going to be building another building with more pods for Stevens County.
So I think some of the discussion was, at least what I remember, it was how do these things get funded, you know, whether it be a municipality funds it, a county funds it, you know, or a private organization chips in.
What Stevens County had did to help with that building was, I believe, ARPA funding.
That's
I
correct.
recall. So
That's what they used our ARPA funding on.
with the new daycare regulations that are being proposed, from what I understand, I'm not an expert at this, I'm first going to recommend that they get Michelle Towges involved early, as they're through Sourcewell in our daycare licensing.
I believe she was at the meeting
Great.
from the Sourcewell. Michelle?
There was a Sourcewell individual.
There was
Okay,
a Sourcewell
perfect,
individual there. More than one, I think.
And Initiative Foundation.
Yeah.
That's great. That's good to hear. Some of our staffing maybe could be a part of that $600,000 that we pay for Sourcewell contracting as the in-kind. But again, not being the expert on this, but what I understand is some of the new legislative language changes to childcare licensing might make it more difficult for the pod model to move forward. So I just kind of want to say that out loud, but again, I'm not the expert on that and the regulatory, the proposed changes that come through, but I know there had been some concerns around the new
Regulations.
regulations around pods. So Stevens County, what I understand and what I've heard, may be grandfathered in, but any new might come on some challenges.
Well, I talked to Donnie from Stevens County. He was concerned with the same fact. I guess sitting there and listening to this, my concern was, is it the brick and mortar, the housing, the part of it? Or is the employment to get the people educated enough to be able to run these daycares nowadays? Because like you said, the rules and regulations are changing so fast that it's hard to be able to keep up what is most needed.
I would say yes and yes. Yes, there's pod buildings for them to coexist is, there isn't many that can probably house multiple independent daycare providers. From what I understand, and Jackie, maybe you know a little bit more about the Stevens County model, they offer the licensed daycare providers a very reduced rate to
That's correct.
Yeah.
make it profitable. And then they contract with that provider to keep them in you know, marketable or in the green. Daycare, to be an in-home daycare provider, it's a tough business. It's expensive, it's long hours. They're usually having to utilize their own home or buy a home to do that, so that is tough. And then all the regulations that come along with it. So yes, to find daycare providers to do it is tough because it's not an easy business. And typically, we have found that we have very good providers, but most do it while their kids are young and then stop when their kids get on into school full-time and they go back out in the workforce. Not always is it that way, but that's what we have seen historically as our trend. But yes, so yes, it's hard to find the workforce to do it with the hours and the demands and the, you know, business hours. They seem to never get a vacation or not enough. But also the building to be able to, some of them are old, some of them just are not. I mean, you're only as good as the building that you would work in, and some of them are not structurally set up for the
They don't have fire
multiple
suppression and different things that
Yeah, I
that
think
are
that's
needed.
what was brought up also was talking, I believe they're churches in Long Prairie.
Yeah. So, I mean, I guess, I'm not sure where this goes next, but at some point, one of these civic entities is gonna have to try to be be some type of funding source, and, whether that be the county or the cities, we'll have to have more meetings, I guess, but, and how could you fund that? Because we know there's buckets of money out there, but what's the priority for the county? Is the priority for the county,
And the other
X,
thing,
emergency management, and what is a childcare, and how are we gonna, attract more businesses here? Will somebody come here if there's no childcare? I mean, ECP is buying, 3 more lots to do warehousing, and they could expand that place as big as Barrett Pet Food if they wanted to. I mean, they got contracts with every major grocery chain across the country who wants to buy their macaroni and cheese and stuff, so. But if you can't, which is help our tax base, so.
And we're seeing need, really a great need is for infants.
yes, they brought that up
That is our
too.
greatest need at this time. We are seeing there are slots that are open for adolescent and toddler. That is where our greatest need. And then yet, even with the pod model, you still have limits on how many kids you can take, so, or infants you can take. So that's where our greatest need is. But that's also our younger generation that brings people into our town and our county and want to work. So there is, you could do daycare centers, but then that's licensed by the state, and typically you see those centers starting at preschool ages. So there are some that will do infants, but like our Bertha Hewitt one, we're seeing that to be a a precursor to get them into the schools, which makes sense, that adolescent age.
They lowered that one down to 18 months now.
But they did.
Yep.
So that's
But that
great.
one is used pretty much by the
District.
teachers, correct?
No, faculty, they have there's incentive, there's a discounted rate for incentive for faculty, I mean, to kind of draw them into the school, that they would get a discounted rate there, but no, we use that one as well, but that one's stacked full, by many people in the community, and that one's nice, but yeah, like the infants don't make money. Some does do, just because of the few amount you can have. Does Stevens County's pod, do they do infants or no?
I believe so, because they're.
Yes, they do. And
okay.
just as a follow-up for why maybe even the conversation here with our commissioners is the Stevens County model is that Stevens County themselves is the landlord for the building where the pods are located. And I believe they start out with the first year, they have a lease agreement with each of the 6 business owners, whereby they're paying approximately $150 a month rent. And then after the first year, that does go up, but not by much. Stevens County is only the landlord. They don't have anything to do with the licensing or the overseal of the small businesses that are located within those 6 pods. And they've just seen a real success for the 6 business owners with the pod system, and that's what the administrator reported. So I think that's why even the conversation is being brought up here is, you know, I think the ask might come to the board that, you know, somebody needs to be the landlord, and then also to match that grant dollars. That 1.2 million is what it's going to take to build the building, and they can get half of that from the grant, but they need a match of about 600,000. So that's kind of where that all originated.
And how many kids with that one, like that specific one, Howison?
72, right, Bob?
Right here,
Yeah,
72 kids.
72, okay, I missed that, sorry.
So with that land and the utilities donated by Long Prairie, wouldn't that 150,000 count as part of the match?
It might.
Could it?
I would
It
assume.
might.
I mean, so you're talking
look
now
at the-
450,000? I mean, it's still a lot of
Probably
money,
does,
but,
Lou.
you try to.
They're
gather
not,
what
they're
it-
not, and they weren't coming for the whole 600,000. They were
Right.
just, they're
Right.
looking for sources in the community and the county for all of, you know, the 600,000.
Part of me kind of thinks that, okay, there's a little bit of a model out there that's successful. And, you know, this obviously this ask is a Long Prairie area ask. But I mean, is that same ask, could that apply if it was successful here to Staples? Is that same need in the northern county? I imagine it is.
Oh,
Well, I'm
absolutely,
sure
absolutely.
it's
I mean,
needed.
Yeah,
I mean,
you could have one in every one of our districts, easily.
And you know, I don't know how, but at
Central
the end of the day, I mean, we are still pretty much I mean, Stevens County is all ag too, man, you know. It's dairy city and fields, same as we are. We have quite a few more lakes, I guess, than Stevens County. They got one river. But, you know, I think would be somewhat short-sighted not to consider how we could help. And I know that it's, again, there's these buckets of money and somewhere it's got to get taken from somehow, some way, but, and that I don't know. That would be a treasurer and bigger discussion and stuff like that, but.
You know, Commissioner, maybe what we should do is do a survey like we did for solid waste and do a mass mailing out there and throughout the whole county and get some feedback, because I have no idea out in my area who needs daycare. And if there's a real shortage, I know there's a shortage because you hear about it, but we should do a survey, the county board should do a survey and just find out, you know, what's the need? Is it from infant to 2, toddler stage, and then from 2 to 4 or 2 to 6? But we need to find out throughout the county, the whole county, what's the.
Yeah, I can, you know what, Commissioner Newman, I will get some data that I think would be helpful. I know that they projected that countywide there was 450 slots they could fill. I don't know where that data came from, but we can certainly find it.
I think we can get that data from Sourcewell, Michelle told you, and she can pull up. We also have Alyssa Erdman, who we had been working with on the licensing. They've got the data. But I also think we could pull together an online survey fairly quickly that could target and push that out through our Facebook
Yeah.
pages.
Now, Jackie,
and
when's
pull
that
some
summit
data.
in Staples? We talked about going to the daycare summit. That's coming October.
Right at October 9th, I believe, at 9 o'clock at Central Lakes College. And it's kind of a twofold summit. It's for providers on one side, but it's also for community champions or people looking to
Sourcewell will be going as well.
address childcare shortages.
Was that the 24th?
Did I say October 9th?
The ninth, yeah.
I'm thinking it was the 24th.
I think, yeah.
I think they're even presenting, so they would be able to pull.
Yeah.
Some
I-
information.
You know, because we were talking about
We have to
registering
do it
for
the whole
that.
spot.
But we've got facility meeting already planned for that morning. We moved facility to that morning.
But, you know,
So we
and-
gotta do
Yes, that's
some-
right. It is the 24th.
Yeah.
And I do think this is not specific, but I do think the board or the county has to seriously start thinking about sales use tax revenue generation, whether it be cannabis, alcohol, whatever that is. I mean, you know, these grants are available for extended time, then they're gone.
Right.
Then what happens to, we have a X $1 million facility that's not able to function because we haven't figured out a continual, like, you know, residual monthly source of revenue to help. 'Cause they'll go away at some point.
Well, like they say, the wages you're getting paid, and it's no business than any business in Todd County. You know, it's the cost of your products here, and what you're getting paid is here, and how do you make up that difference? And I see it in every downtown business that's trying to make it right now. It's the economy we're in, yeah,
No.
That's all I
Grandma.
got.
yeah.
Sure,
So I
it's
don't
down
know
the
if you
road.
got more info you can get us, or,
As I get it, I forward it
Yeah.
on to Jackie Bauer and Melissa typically, just,
yeah.
Yeah.
Yeah,
I know
we,
Todd County Economic Development has been busy working on this, so,
Yep.
yeah.
I don't think,
don't
one
know,
last
you
thing,
can
Richard, I
ask.
don't think they need to have the committed funding, but they have to have a plan for the funding, if I remember right. Didn't I ask that question? Maybe that was a one-on-one conversation.
Nah, I don't.
Anyway,
Ask a question, what is the intent of that Trinity if it's being utilized so nice for daycare?
workforce, I think is what I understand. They're just having a hard time staffing it.
Yeah,
Okay,
it's
so it's
the
a building that
staffing
could
part
still
of
be
it.
used.
I don't know.
Yeah.
I'm just wondering,
Well,
instead of investing in a huge.
somebody from Trinity was at the meeting,
Oh, they were.
and there was some discussion about, you know, they made that decision, the elders made that decision, and then someone brought up a point about how they could extend it for a while, and they think they were trying to do that, but I think there's only 15 families left that haven't been placed.
Yeah.
Like St. Mary's took 7 or 8 of them, wasn't it? 7 or 8 of them? They turned down like 5 because their numbers were maxed out too, because they had that Montessori now. So
But
people
that's
are
where you go
finding them,
again.
however they're finding them, but out of the 42, I think there's only 15 left that are not placed.
Is it the labor or is it the building?
Yeah, well, during COVID, they were granting daycares some variance on some stuff that we were, 'cause there's sort of shortage or whatever, so we, I know
It was labor.
a couple of our kids, they got a year variance. Is that a possibility anymore right now, being that this is shutting down? This is pretty crisis. Are they able to, I wonder if they're, I mean, I'm guessing it's still available to, in-home ones were requesting a variance to take on a couple more kids or whatever.
Yeah, that's, yes, we do grant variances, but that's on a case-by-case
Sure.
decision because some daycares operate, they have staff that can help, or maybe they don't have other citations that they, you know, might have had a citation for previously. So it's really a case-by-case variance on where they're requesting to go and if there's capacity or
Yeah.
what the past history has been with the daycare provider as well.
Makes sense. Okay, thanks.
Okay.
Thanks.
Okay, I'm sure there'll be more on this topic as we go.
Oh, yeah.
Go along, yeah.
yeah.
So, okay, thank you, Jackie.
Thanks, Jackie.
Iran's gonna attack Israel.
Yeah, I seen that, I seen that.
Imminent attack.
Great, we need some more to step into and.
Unrest,
screw up.
yeah, unrest.
Oh, they need to cut that out. That might.
Well, enjoy that cannabis meeting. I'll be watching.